here today. It's my pleasure to introduce Dr. David Grigler here, who's going to be talking about providing COVID-19 updates, talking about some of the community issues and challenges that he's found. He's a hospitalist at St. George Regional Hospital, and it's a pleasure for us to have him here today and welcome him to his talk. Thanks very much, Dr. Grigler.
Thanks. I would like to thank you for the opportunity to participate in this. I'm from a very small town in northern Arizona, almost in Utah, and so I really appreciate the work that the organization does to help bring quality care to sort of the far reaches of unpopulated areas. My first job out of residency was in Panguitch, which was a remote area where we got lots of visitors, and so I appreciate the difficulties that some of you face, and I'm grateful for the opportunity to talk about this today. So I know that this is your favorite topic, and it's certainly my favorite topic. When I was asked to talk about COVID, I thought, really? Is there any more to say? And so I've been trying hard I've tried to come up with a few things that might be useful and interesting to you. So as we go along, let's see if we can get something. Anybody interested in learning a little bit more about the vaccine? You feel pretty comfortable about that? All right. Want to hear how our healthcare system is doing locally and in the state? And how is COVID in the community right now? What does the future look like for us? And then I have a little debunk session at the end if we get that far. But I have some things that might hopefully be useful for you. But first, a little bit about, and then you'll get an opportunity to hit me up. Of course, I'll have a question and answer session at the end. So these are my feelings about vaccination. I had the opportunity to get fed up at some point in my career, and I'd gotten off of Facebook, and I decided that I was going to have my say, and so I did a Facebook post in the smartest way possible on my wife's Facebook account because I was not willing to dip back in. And it got picked up, and Dennis Romboy, who's an amazing reporter at Deseret News, wrote a probably provocative story about my feelings and thoughts about COVID and the second wave of COVID that's taking so many people. Unfortunately, fairly unnecessarily. It didn't really have to be like this, but human nature being what it is, it's happened. And I'm hopeful that some of the things that I have to say today will be helpful to get over the edge on the last few people who might be resistant to getting some artificial protection against COVID infection. So just a little bit about me. It's okay. We can all be friends. I got a couple of degrees at the University of Utah as well. This is my family. I had the great fortune of finally finding my wife at age 42, and heaven said, "You're still getting your full measure." So I got 6 kids in 4 years. The boys are triplets. And when they were 4 months old, we found out we were pregnant with twins, and that's the girls. And then we rolled the dice and had Jonathan, who of course is the apple of my wife's eye, and he's the best of all of them. And anybody who's the youngest child in the family knows that they really are. And let's go ahead and get started. So this is the most current data that I've been able to get. This is nationwide, the cases in the United States, and it's daily positive test results. And as you might imagine, there's a pretty big chunk of people who have COVID that are not tested. And so the real, Johns Hopkins has done some data, and it's anywhere from 150% of this measured number to 3, maybe even 400% of this number is the actual number of cases. And the area under the curve, it's very interesting. If you look at the area under the curve for the Alpha variant, which happened, let's see, in this time zone, it's bigger, it seems like, than the area under the curve in the second wave or the Delta wave. But as you'll see a little bit later, the hospitalizations is the opposite. So I think people are not getting tested for the Delta variant quite as much. These are our regional case counts. Utah is the purple line, and this is through, what's the date on this? I think it was the end of October. And so this is new case count. I think this is probably a little bit late, old data. And this right here is the vaccination rates. I'm sort of blowing through this so we can get to sort of the meat of the discussion that I was hoping to have. So this is good. This is hopeful. The line represents our, no, this is the wrong, this is the not hopeful page. This is the totals. 101.9 million Utahns have received the vaccine. And I'll have a slide in a minute that will show who's been vaccinated and where our opportunities for vaccination rest. And these are the current hotspots in Utah. And as you might imagine, so these are per capita. So it only takes one person in Grand County to really raise the rates compared to one person in Washington County. And I always compare a pandemic to a fire. In my childhood in Page, Arizona, I don't think I was super smart. And the wind liked to blow and pick up the tumbleweeds and blow them into canyons. And so we would take our matches to this canyon and we would light the tumbleweeds on fire, and it would be like boom. It would start small and then it would get big and then it would end. And the different outbreaks of COVID right now, I think we're in our fourth or fifth wave, but our second big wave is like that. We're sort of on the burning down period of that, except for the areas that are farther away from the high population areas are lagging. That means they're getting their outbreaks later. And unfortunately, the vaccination rates in some of the rural areas are a little bit lagging as well. So this is where I start to make the argument that vaccines are useful. Whenever someone is making the choice to be vaccinated, in their own mind, they're doing a risk-benefit analysis, and we all do them. If we decide to put on our seatbelt that morning, we're doing a risk-benefit analysis. If we decide to take our high blood pressure pills, we're doing a risk-benefit analysis. And if people perceive benefit is greater than risk, typically they'll do a thing if it's not that hard to do. This right here are the vaccination rates of the different types of patients that we've seen since vaccines became common. Really more common in April or May is when it really started having penetration in the population. And the left box is the area where confusion can occur. And I feel like it would be a disservice to not point out that the messaging around COVID has been mixed, chaotic, poor, and it also includes black and white thinking or black expressions of black and white scenarios, which are not real. There's nothing in the world that's black and white except for maybe pregnancy. It's like everything else there's an aspect to it that can be considered. Early in the pandemic, the argument for masking was made. And then a scientist compared the size of the vaccine particle to the pores in the different masks that were being used and made the picture very cloudy in something that could have been a very straightforward argument. If you wear masks, you're less likely to get COVID, and you're less likely, if you get COVID, to die from COVID, because you're less likely to get it in the first place, and you're probably getting a lower viral inoculum in the second place. You're probably getting less severe disease. So instead of having like a very clear, hey, masks are like seatbelts. Not everybody who drives their car without a seatbelt is going to die, but if you're in a wreck and you're wearing a seatbelt, your chances of dying are much lower. Instead of having like a really straightforward conversation about masking, it became confused because some of the technical aspects of the mask, and unfortunately, some scientists felt like it was more interesting to get in the newspaper than to promote public health. It sowed confusion, and then it sowed division. And unfortunately, the pandemic has sort of been a divisive issue that's made enemies of friends from the beginning. I find that just utterly tragic. And I think one of the things I'd like to talk about today is how to sort of lower the temperature on the discussions so that we can make friends out of enemies and friends out of friends again. But the evidence is fairly clear that in the COVID realm, if you wear a seatbelt and you're in a car accident, it may not save your life, but you're much less likely to die or be seriously injured. Here's the data. And it's the left box, the yellowish box, that says you have a 3.7 times greater risk of testing positive for COVID-19. So this is the area, I think, where the greatest disservice has been done to people. They focused on this box to try to say vaccines are not have no utility, or the utility is negligible. And then they try to make the argument that the risks of the vaccines far outweigh the benefits of the vaccine, which is demonstrably false. And yet it's what's happening. And I'll talk about why I think that's happening in just a minute. The middle box is your chance of being hospitalized. The orange line. So these are age groups. So the people that are most likely to be vaccinated, if you're looking at the center one, is the 70, basically to 70 and above crowd, or have the highest risk of hospitalization. And if they're vaccinated, they have a much lower risk of requiring hospitalization. But even with vaccines, you can see that they have some risk of being hospitalized despite being vaccinated, which would make sense. In any risk reduction scenario, there's still going to be people who don't benefit from the risk reduction strategy, whether it be seatbelts or teeth cleaning. I just feel like if we could move COVID vaccination into the realm of other risk reduction strategies that people will accept, they might have a better chance of accepting it. And then, of course, the money item is, are you going to die if you get COVID? And you're 9 times more likely to die if you're unvaccinated compared to the vaccinated people. But if you look at the 80 plus crowd, there's still a death rate associated with vaccinated people. And it's for the reasons you might imagine. There's something up with their immune system that makes them unable to respond to the vaccine properly. And then another point I'll make in greater detail in the future is another reason for you to get vaccinated, a young, low-risk person, is to protect the high-risk 80-year-old person. And it's another reason to wear masks. This goes on to make the point further. You can sort of see when vaccines came on the market in this graph. So the first orange wave, the big orange wave, that was the alpha wave. That was the first thing that we had where it was really a terrifying time. And nobody knew where the top of that hill was going to end up until it finally wasn't the top of the hill anymore. And then we had setbacks for, like 2 months where things started looking worse again. Then you're wondering, are we going up or are we going down? It's a very difficult time to be a provider, a very scary time. And it burned out a lot of nurses. We've lost a fair number of nurses related to that. But then in March, you start seeing the effects of the vaccine, and we're able to measure the effect of the vaccine. And you can see that the people who are being hospitalized are being hospitalized at 3 to 5 times the rate for all comers. Okay, so I said before that the positive rate that we looked at was talking about how many people had COVID. And it seems like that the Delta wave that we're in the middle of, or hopefully starting to be on the backside of, was smaller. But if you look at the area under the curve on this graph, so when you think about the area under the curve, if you took this area to here, let's take these 2 points, and then added up all of the square inches, millimeters, something like that, and all of that recommended illness burden, if you compare that area to the Delta area is going to end up being a more dangerous, more deadly wave than the Alpha variant was, even though the testing numbers don't really support that. And I think, like I said before, I think that's probably because people aren't being tested at as high rates. I recall at the beginning of the pandemic, everyone was so worried about 3% positive rate. And now we ho-hum at 15%. Oh, we're baseline for 15%. Probably there's more of it in the community. And also I think more people are not being tested. So the proof is really in the pudding, which is to say people are coming to the hospital at higher rates. And let's see. So here's a little bit on what's happening with our hospitals. Does anybody anybody suspect that our hospitals are not full to the brim. I need to spend too much time on that. My brother-in-law is the medical director for surgical services here at our hospital, and I can tell you that there are people suffering with bad hips and bad knees and pinched nerves, people with new diagnoses of cancer who are not getting their surgeries because there's no room for them to be admitted to the hospital. So this is having like real inability to get our numbers down, is really having real world effects on non-COVID patients as well. There are people not getting their mammograms, people not getting their colonoscopies. You know, they're preventable cancers, they're not being discovered. I think the final toll on us as a people, it remains to be seen, but it's going to be enormous. Okay, finally, the hopeful slide. We're going to start getting there. So these are the percent of vaccinated people in Utah, and if you look at the third column, well, let's look at the graph first. So when the vaccine first rolled out, you see this huge peak at the beginning. Who do you think that was? It's everybody who's a hermit for the last year who are like, let's get my life back. People who are vaccine acceptors, and this is typically the 65 and older crowd. They're like, give me the vaccine. I gotta see my grandkids. I want to get back to my life again. So you have this enormous bump of people at the beginning, and there's another graph that will show that. And then since then, in July, it sort of tapered off, and that's when we had, I think, 3 people in the hospital, and that lasted for like 2 weeks. And then Delta hit in July, and then there's been sort of like this steady trickle of vaccination ever since. And it's like, it's good, and it's been up a little bit lately. If you look at this number right here, 12 and up is where the vaccines are licensed to at this point. A number that I prefer to look at is maybe 18 and up or 21 and up, because these are people that are really at risk of a more elevated risk of being hospitalized. The risk of children being hospitalized for COVID is fairly minimal, not zero, but certainly much more dangerous to get RSV or influenza than COVID for the children. But we're getting there. 75% have had 1 dose, and we know that 1 dose gives like fairly significant protection. So I feel positive about that. Here's by the age group, and we talked about this a little bit before, which is no surprise. So this is by the time, this is time right here. So if you look, basically in February, the 70 and above group, they got vaccinated at a very high rate, like within months. And that made a huge difference. So when Delta came along, so when I was caring for patients during the Alpha wave, it was essentially old people. There's a few young people. And we know that the Delta, everyone's talking about how contagious the Alpha variant was. And my gosh, it's as contagious as chickenpox. And all of me and my providers were like, I don't think I've seen that before. And a vaccine eradicated illness, and you don't even see chickenpox anymore. So the irony is that they're trying to make a comparison about how contagious it was to something that didn't exist anymore. So it was ironic. And then people start picking up here, the red line, the 60 to 69, people starts getting more interested in April, and they get pretty high rates above like 75, 80%. And then of course the lagging group is going to be the younger people. This is Dixie St. George Regional Hospital's census, and it mirrors what's happening basically all over the state. The blue line is our total patients in the hospital. We're hanging about 70 right now. The ICU is about 30. Our ICU has been expanded using the emergency rules authorized by the state, and we've got, I want to say, like 20 or 30 extra ICU beds and almost enough nurses to staff them. It's a real problem. And then of course the red line is deaths, and we're having about probably 1 to 2 deaths a week. And this right here, the upcoming slide, is really the money slide. I think if you want to show someone vaccines help. This is, you get the shot, you're not going to get as sick, you're not going to die, you're not going to be in the hospital. So the blue dots are unvaccinated patients. And this is on November 5th, so just like less than a week ago. You can see it's a very small fraction of our patients in the hospital who are vaccinated. And the ones who are vaccinated have immunosuppression, they're advanced age, there are other reasons that the vaccine did not work for them. And then even more provocative is the ICU, 2 out of like, what's that, 23, 24? So if you're gonna get sick and you have the vaccine, you're much less likely to get severely ill. To me, this is like a really useful slide to combat the idea that vaccines are useless. There's a lot of debate around how contagious people are when they are vaccinated and contract COVID. I personally don't think that your viral loads are going to be as high and you're not going to be as contagious. One of the problems with measuring how contagious a person is, there's a concept in epidemiology called the R0. Have you heard that number before? R0 is how many people you, if you are sick, can give it to. So the R0 for influenza was like 1 or something like that. The R0 for alpha was like 1.8 or 1, you know, some smaller number. The R0 for delta is like 5 or 6. So it's much more contagious than the previous one. I personally think that vaccinated people's R0s are going to be reduced similar to their hospitalization rates. You can't prove it. I can't prove it, but I think that the vaccine is reducing transmission. Okay, so when I was preparing this talk, I was trying to figure out what do people want to hear about? And then I came upon this. I opened Yahoo to see what the world's thinking about. And this was my page yesterday. Okay, so what's the message from this? From the big one? Vaccines don't work, right? Why is COVID surging in high vaccination states? Subtext, don't get vaccinated, it's useless. That's the subtext. Why don't they say, what are the hospitalization rates? Nobody cares about that. That's not interesting. They're not going to get a click on that. And so there are the people that are giving us information have motivations that do not align with public health. And it's very confusing to the lay public to like sort it all out. Matthew McConaughey had some controversial opinions about it. So the Surgeon General, Dr. Murthy, had to go after him. People are getting billed for a free COVID vaccine. Oh, that's interesting. The 5th wave of COVID is unfolding in these states. So like out of it's a very hot, it's a clickable thing or it wouldn't be there. People are stressed. And then of course, Olivia Munn, who I don't know about, had a baby. So that's cool. I want to talk a little bit about why people are resistant to reason and resistant to statistics. This goes back to developmental biology. When are any of you guys on Instagram? There was this Instagram meme going around where they had this song that they would play very loud. It's like, I feel good or something like that. And they would put the speaker by the person and then they would film them jumping and like, you know, basically crapping their pants because they're so scared. The part of your brain that is activated when you're scared is a deep part of your brain. It's resistant. It keeps you alive. If a lion jumps out, that part of your brain says fight or run, depending on your, you know, the situation and how you're made, you know, what kind of a person you are, I guess. Thank heavens for the fighters. I don't know where I hope I never have to find out where I am. It's the limbic system. It's the fight or flight part of the brain, and the media gets clicks by activating that part of our brain. The part of our brain that's open to reason, you know, you really should consider, you know, whatever rational thing that's up here in the frontal lobe, and it is overwhelmed by the limbic system and the animal brain. The lizard brain is what my biology professor called it. So our patients and we ourselves are being bombarded with stressful images, stressful messages that activate the part of our brain that makes it very difficult to do a rational analysis about things. So these guys earn money by turning up the heat, and we help people get vaccinated by turning down the heat. And I've had a couple of opportunities in the last 2 weeks to have vaccine conversations with people who didn't know I was a physician. I'm going to talk about that in a minute. Let's jump right in. So I had no idea the Census Bureau was useful. And yet, they're doing polls all the time. If you get on their homepage and look at the different types of polling that they're doing all the time, this is a pretty recent one. It's called the Household Pulse Survey, and they go out and they interview a couple thousand people because they have unlimited resources, and they find out, why are you not interested in getting vaccinated? And you can select more than one option. Do these sound like rational reasons to not get vaccinated? Are you worried about side effects? Of course. Who wouldn't be worried about side effects for a new therapy? I'm not sure it's going to work. I don't think it's going to work. I'm worried it's not going to work. So you don't trust the COVID vaccine. Those are two very rational reasons to not want to get vaccinated. I think anybody who doesn't have these thoughts when they're considering new therapy should probably turn up their sensitivity a little. How about the next one? 48%. And that's where I started talking about the divisiveness of the campaign to try to manage COVID. Don't trust the government. So depressing. So depressing. I don't think I need a vaccine. Okay, so if you do a statistical analysis of your chances of dying or being hospitalized based on age and wellness level and absence of other comorbid diseases, your chance of getting serious COVID might be minuscule. Is that rational to make that, to think about that? Yes, rational people are going to have these considerations. I don't think I need the vaccine. I don't think COVID is that big of a threat. They're doing a risk-benefit analysis based on the information that they have. The point I wanted to make with this slide is when we look at someone who's vaccine hesitant and make a moral judgment about them instead of a rational judgment, we're doing them and us a disservice. We really need to look at their situation and say, okay, they might have some really reasonable reasons that they're not being vaccinated. Why don't we talk about it? Lower the temperature. What is it? Remove the heat and add some light. Let's turn down the heat and just think about it. So this is from Kaufman something Foundation, and they do polling on vaccines as well. So this is a really dense but very interesting graph. So they've been tracking vaccine hesitancy from basically before vaccines even came out. So the interesting line is on the right, the green, the dark green. These are people that would not be vaccinated in any circumstance. If you look down at December 20th, when they polled people, there's a fraction of people who knew nothing about the vaccine that would still never be vaccinated in any circumstance. And then you jump up to our most recent date that they have is October 21st. It's almost exactly the same. So these are people who, for reasons unrelated to the vaccine, don't want to be vaccinated. A tough group to work on. I think there's room that and I don't, people report what they report, but it may not be, they may do something different than they're reporting in this. And then the next group is the only if required group, which has gotten smaller and smaller. And then the wait and see group. So if you look, since our vaccination rates are approaching, 76% in Utah and other states, it's even higher. The group that we can make some inroads on is getting smaller and smaller and more difficult. So I'm just bringing that to your attention because we're going to talk about the vaccine mandate and people's choice to leave their jobs, which can really be a challenge in rural areas where the workforce is already limited. Are you going to lose a third of your workforce over this? Gosh, you hope not. But when there's only 3 people and one person doesn't want to get vaccinated, it's a real problem. And this is something that has to be sorted out. And I do feel like there's a path forward. It doesn't have to be a zero-sum game. There can be progress. And they asked them, well, are you going to quit? If you have to get a vaccine, are you going to quit? And so it's very interesting. I don't know why they do party ID, except for they just have to pit people against each other. Let's just make some more enemies. Let's make an us against them mentality. If you want people to get vaccinated, you must be my enemy, or you're my ally, or whatever. So unnecessary. But if you come down and look at the very bottom, it says 90% of unvaccinated people don't want their employer to require vaccination. I guess that's no shock. But interestingly, among the vaccinated people, fully a third of them don't want the employer to require it. So that's very interesting too, right? They're like, well, No, people ought to be able to make the choice, so that even among people who've made the choice to be vaccinated, there's sympathy for people who have not yet been vaccinated. So I thought this was an interesting slide. And then this is where the rubber hits the road in tight workplace staffing issues. Am I going to lose a big chunk of my staff if I require a vaccine? And what I understand is, if you're accepting CMS dollars, which is Medicare, Medicaid dollars, you have to require your staff to get vaccinated or have a legitimate exemption. And if you look at this, there's a decent chunk of people who will leave their job if they have to get vaccinated and they can't keep working because testing is not available. For the administrators in the room, or the board members or CEOs, that just gives me sweaty palms to think about your situation. It's a real challenge. So the ability to help people to accept vaccination or identify the people who meet the requirements for exemption is important to be able to maintain your workforce. And this right here is a fabulous tool. I'll hit some of the high points. This is from Johns Hopkins homepage, and it was written by Dr. Golden, and it was just right in terms of an approach to how to talk to people about vaccine hesitancy. It's a list, and then there's a paragraph underneath each heading, and here they are. And it basically hits like the main concerns that people have, almost in the order. It's almost like they looked at the previous study and said, well, what are we gonna talk about? Well, let's talk about the things that they're the most worried about. If the COVID vaccine was created too quickly and it was rolled out too quickly, okay, is that a reasonable argument 8 months ago? I mean, there's a reasonable person that could say, yeah, that's pretty fast. I feel a little nervous about this technology. I never heard of the mRNA vaccine. I mean, the mRNA vaccine before. Is it even a thing? Did they like pull it out of a closet? Well, it turns out that the mRNA vaccine concept has been around for decades, and they've been working on it for decades, and they had an opportunity because technology was like ready. There was technology ready for the moment, and then they rolled it out, and they used large numbers of people, and since then, billions of people have been vaccinated. The rates of side effects are now well known and well documented. So now you can have number one is yes, that may have been a true statement in February. That is no longer a true statement. Literally billions of people have received this vaccine. The vaccine registries are catching all the side effects. These are your risks. And then you give them the risk of injury, and they're like, oh, you mean my risk of vaccine injury is 1 out of, I don't know, 15,000, 30,000, depending on your age group, like a very low risk. And then you look at your number, oh, my chance of hospitalization death is like 1 in 1,000. Oh, then they can do a risk analysis based on reality. And they can say, okay, it's, I don't know, maybe 50 times more dangerous for me not to be vaccinated and get COVID than it is for me to get vaccinated and then be protected. And then number 2 is side effects, and 3 is getting the COVID vaccine can protect you from getting sick. And I think the previous graphs demonstrated that very clearly. And then number 8 is the one that I think is the most useful, which is you getting vaccinated helps the little old lady next to you that you go and say hi to, and you take her trash can in, and you visit with her for 10 minutes, and you give her COVID, and then she ends up in the hospital and dies because you were being nice to her. You being vaccinated protects her. And I think there's this this urge of community protection that really could be tapped into if people were having the discussion in a way that could be received. It certainly resonates for me anyhow. Vaccines are made from aborted fetuses. It's a really hard one. This is an ethical dilemma that's been going on since the 70s, since this, okay, are you familiar with this? Have you heard this at all? So I want to say it's like the 1973 or 1974, they're working on creating human cell lines that they can use to test different drugs and therapies against to see if it's going to injure actual humans. You know, back in the day, you'd take a rabbit and you'd put like lotion in its eye and see if it burned the rabbit's eyes. It's horrible, right? So they tried to come up with a different way of testing on human cells so that you could see if it's actually going to hurt them. And these immortalized cell lines were the way they did that. They genetically altered kidney cells from an aborted fetus, probably an aborted fetus, could have been a miscarried fetus. And they've been doing this literally for hundreds and hundreds of fetuses, and they finally got it right. And they developed this cell line, which is still in existence today. It was in the Netherlands like, what's that, 40 years ago. And it hasn't happened since because they got what they needed to be able to move forward with medical research. And it happened. It existed. It's a real thing that actually happened. And then the ethical question is it appropriate for me to receive therapies if you feel like abortion is wrong to receive the benefit of therapies? This is like a very complex question. These pro-life Catholic scholars have an article. The reason I put it up here is because it was so thoughtful about the ethical dilemma of people who are against abortion. And yet, if you start looking around at that, there are other therapies that use the same cell line to be developed. You might be shocked. And then if you're going to be a caustic person, you're going to say, well, you're not going to use ibuprofen anymore. That use that. You know, well, what about this? Are you going to use that? And it just builds this like us against them mentality, which is so unnecessary. Instead of saying, well, you're already a hypocrite because you use these other therapies, say, well, let's talk about it. Yes, it's very stressful. It's very sad, maybe even tragic that this happened. And yet we have this new ability that didn't exist before. And the ethical dilemma is real and you need to make your own choice, but here's some information. How do you feel about it? You know, the sacrifice of this child saving literally hundreds of millions of lives. It can be a discussion that can be held in a way that's open, you know, it can be open, and people may still choose that they don't want to be vaccinated for this for this reason. But at least in Utah, so I'm Intermountain employed, and they have religious exemptions and medical exemptions, and they are being very generous with their interpretation of a religious exemption. And I think that's because they recognize, first of all, it is important to get everybody vaccinated. Second of all, the people who get vaccinated are going to do better as a group and as individuals. But third of all, not vaccinating everybody and still keeping the employees that we need is also a priority. And so having exceptions that are acceptable is and rational and dispassionate when you're evaluating them is critical. Let's see. Okay, so this is interesting. So the vaccine mandate rolls out, and people are like, "Oh, check it out! The court says we don't have to do it." Is that true for you guys? It's not true. There are two arms. There are two ways that the mandate is rolling out. One way is for companies of larger than 100, which has a current stay on it. There's no telling how that's going to go down because the constitutional grounds for the federal government compelling whatever, you know, it's complicated. I'm not going to get into that. But people who accept Medicare and Medicaid dollars are being required to get the vaccine through CMS, and that's a different rationale. It's a different mandate, and there is no stay on that. That's going to happen for healthcare industries. So I thought that was a little interesting twist. And this right here basically just talks about that. So we have 7 minutes remaining for you. Comments, questions, thoughts?
I think the government's communication has been poor. I think it's caused a lot of people to stay in that 15% where they've just decided not to accept the vaccine. It seems like there's not been a good message about the rewards for the vaccine. Mm-hmm. It doesn't resonate to say, well, if you get the vaccine, you won't harm someone else. Well, I mean, it resonates with me, but it doesn't resonate with most people. There never seems to be a discussion about when the masks will come off. Mm-hmm. And I think the masks are a hot topic mm-hmm. that people want to see curved. And again, you don't have the answer to this, but it doesn't seem like the government's doing a good job of helping the American people see what the benefits would be in 3 months, for example, for everyone, if,
Yeah.
and it's frustrating.
So I live in no mask land. I live in southern Utah. People come to southern Utah and they're like, is there even a pandemic down here? So it's different down here. Even from Salt Lake area, the masking environment is different than the masking environment in southern Utah. And you're right. I don't have a great answer for that. I do feel like high risk people, even if they're vaccinated, probably should mask for their own self protection. I think the culture allows for people to wear masks who feel uncomfortable wearing masks. Yeah, I don't know. It's tricky.
It's like, if I've been vaccinated and you've been vaccinated, why do I need to wear a mask next? You know, I don't know her status. Why do I need to be punished because of your choice?
Well, I think part of the black and white thinking that accompanied the early COVID pandemic is still present, and we know that immunity is waning. Natural and vaccine immunity wanes, and so booster shots will help. There was a study recently that showed that this is where I get a little angry with my scientific brethren. There was a recent study that came out that showed that people who were 5 times more likely to get a repeat case of COVID if they had natural immunity compared to vaccine immunity. And then you go back and look at the era when they were studying this data, and they're comparing people who were exposed and recovered from the Alpha variant, and then subsequently probably being exposed to the Delta variant, which is really a different virus in a lot of ways. And there probably is some cross benefit, but then they make the blanket statement is natural immunity doesn't work. And people are intuitively, they're like, I don't know if I believe that. And my own opinion, I think when we do this same study in 18 months, I think that if you've had the Delta variant, your protection against future infection from the Delta variant will be robust, especially if you have an intact immune system. And so I guess the take-home message is it's a very, very complex situation. I think the people who want to protect themselves and protect others and feel like that masking helps are going to be strong advocates for masking rules. And there are different, like even in the United States, there are different states that have different feelings about it. Even in Utah, there are different areas that have different feelings about it. I think looking back, we will be able to say with more clarity what worked and what didn't work. But the place where they're having all of the new COVID cases in vaccinated individuals are also states that have masking mandates. Where do people get COVID? Kissing their wife and their kids. So it's like highly complex. It's very challenging. I'm getting ready to move into a leadership role at the hospital in January, and I have been the best gadfly. I mean, I just love like pointing out the flaws of logic, and now I'm getting ready to step on the other side. I'm just like, be kind, be kind to me. So I definitely have a feeling for people in leadership who are trying to make good choices. I think the hypocrisy associated with masking turns a lot of people off. And that's hard, when your leaders are like, do this and they do that. It's just like, I don't know. I'm not sure it could have happened any different in the United States because we're because of the way we are as a country. But it's a tragedy. I think vaccination does help.
At Intermountain, it's stated that if you don't get the vaccination because you receive a waiver, then you must wear a mask.
Yeah, and that's still the rule. You still have to wear a mask.
We all wear masks. So what's the penalty there?
Oh, I think this is oh, go ahead.
Oh, it's a little bit different from a topic, but it's the last few minutes. Given that this is a rural health meeting, we know in Utah there's big disparities around vaccine hesitancy between urban and rural. I work at HPV, huge disparities in HPV vaccination between urban and rural. And what are some success strategies that work in rural for addressing vaccine hesitancy? Like, what are we not doing? What do we need to be doing? I mean,
I think
like state number 47 for HPV.
I think
And what can we do?
if you move vaccines into the realm of other health prevention strategies, which I think is rational, makes sense. If you're gonna get a pap smear to avoid cervical cancer, or you're gonna get a mammogram to avoid breast cancer, or whatever, get your blood pressure checked, cholesterol checked. Who has the most power in that to make those things happen? It's people that you know. It's your doctor's office sending you an email and saying, "Boy, you really, have you been vaccinated? I strongly advocate for you getting vaccinated. Your chances of dying or getting seriously ill are so much lower if you get vaccinated." I really feel like, and I'm a doctor, so of course I have a strong feeling about this. I feel like the personal touch can really help. And in lower populous areas where it's possible to have more direct outreach from providers to individuals, that could be helpful. I don't know any other ways other than person to person.
Yeah. So I'm a pediatric ICU, but I did general pediatrics for a long time. And I agree the message has been terrible, but vaccine hesitancy, I think that 15% or more would have been there from the start.
Yeah,
We have faced this in pediatrics for many years, and we had to really learn shaming, all those things doesn't work. And I think the community education, HPV is a great example. It's been so politicized, and the only way is really to continue to talk and slowly move the needle. Mandates work; they'll drive up the numbers, but you're going to solidify that base that doesn't.
so complex. There was a hospital early, I believe it was in Houston Methodist, that had a vaccine mandate, and they lost a chunk of their staff, and they absorbed the loss. And but the thing that I was talking about earlier, that blue bar that says I would not get the vaccine, that number ended up being smaller when push came to shove. So I think it's probably more on the order of 3 to 5% will really leave their job over it with mandates. My own like soul says, don't boss me around. I'm definitely like, don't push me around personally. But from like a scientific standpoint, if people want to get back, if you want a group of people to get vaccinated, and you know that if you can get this last 10% vaccinated, that 5 or 6 of those people are going to still be living next year who would have died otherwise, you can make a very strong moral case for vaccine mandates. Is it off-putting? Yes, it's definitely off-putting. So messaging from my own hospital, Dr. Carroll is our medical director. He literally this morning, an email came out and he said, this is the regulation, we have to adhere to it, and this is how we can get through it. So sort of their approach is to accept it as a thing that's going to happen, whether we like it or not. Let's get through this together. The people who really can't get it, let's identify you and get you opted out. And the people who need to get it, who haven't yet gotten it, let's have a conversation. Let's figure out what your concerns are and move you forward so you can keep working here. It's a great place to work. We need you. And that can have I think it can have a lot of power.
Medical director at Veterans Home. And so I'm dealing with this, for the last 20 months with minimizing exposure to our residents there. We're highly vaccinated. Our residents are 96+%. Our staff is 85%. However, the exposures we're getting are because of the misunderstanding of what masks are for, actually. Masks are not to protect you personally. I mean, yes, you do get some protection there. It's to protect your friends and neighbors and workers and those we're taking care of. And so what's happening is the exposures we're getting right now are vaccinated people who go home and drop their mask and never wear it again until they come to work again. They're coming in with asymptomatic symptoms or asymptomatic exposures and exposing our residents again. And so the misunderstanding here is we wear masks to protect those around us from that asymptomatic spread. And the countries that have done the best at keeping COVID out are those who have been able to have their population understand that. It's not protecting you. I'm not wearing it for that reason. It's protecting my possible spread to you here. That's what masks do. My other comment is I'm concerned about our numbers here in Washington County are half of what is shown here as far as vaccination goes. We're still at the high 30–40% of vaccination in Iron County and Washington County of vaccination. And what I see is that I see the same stats you see every day from Dr. Carroll. And the public here doesn't understand that at all. they still think, yeah, we're at this high rate of vaccination, and it's our media people, it's our legislators, it's our health department chair, it's our school board members and things that are putting out the misinformation in this community. I mean, I'll show these things to my wife, and my wife said, "I listened to the radio this morning. The media mouth on there basically just says, no, it's not around. This is all false, and we're doing just fine here in these counties." What can the hospitals do better to get that information out? What's happening there in the hospital? I mean, when you're overloaded ICUs and higher death rates now.
I guess all I could say is pandemics are tragedies. People are doing the best they can. And I think trying to be kind to people you disagree with will go a long ways. Last 2 seconds. If you find out you or your friends, someone gets positive monoclonal antibodies, there's going to be an antiviral pill in the next couple of months. So there are some early treatment options coming out. So just keep your eyes open for that. Thank you for the opportunity.